welcome. Today I'm joined by Dr. Esther Lopez Garcia, who is Associate Professor at the Universidad Autónoma in Madrid, Spain. Dr. Lopez Garcia is an epidemiologist who has conducted numerous studies in the area of coffee and health, in particular relation to cardiovascular disease. Dr. Lopez Garcia, thank you so much for joining us. Now, we know that heart disease is still a major concern across Europe. So can you share with us some of your findings on coffee consumption amongst those people who already have cardiovascular disease or on those who are at greater risk of cardiovascular disease?
We found that among people who already have a cardiovascular event, habitual coffee consumption did not increase the risk of having a second fatal event. In addition, we also look at diabetic patients, and we didn't find an increased risk among them.
And are there any groups where you think coffee consumption you need to be a bit more aware of it?
Yes, I think people with arrhythmias, insomnia, anxiety, gastrointestinal reflux should ask for personalized medical advice.
And what about within hypertensive people? Anything there?
We found that habitual coffee consumption didn't increase their blood pressure.
Right, so now that's within those groups. What about healthy individuals?
We conducted a study with over 150,000 men and women from the US, and what we found is that after 24 years of follow-up, those who drink coffee didn't have a higher number of cardiovascular events in comparison with those who didn't drink coffee. What we found is that among them, consumption of 2 or more cups of coffee per day was associated with a 20% lower risk of having a stroke. So this might suggest that habitual coffee consumption may have some beneficial effect on cardiovascular health.
So that's really interesting. So are there any naturally occurring compounds in coffee that could be responsible for this effect?
Yes, coffee has a very complex mix of compounds. A part of caffeine, we can find in coffee chlorogenic acid, which is a phenolic compound. We can also find magnesium, trigonelline, quinates, and some research suggests that these compounds may improve glucose metabolism, and they have antioxidant properties that are able to reduce inflammatory levels in the body. What we believe is that this beneficial effect that we observe from those compounds can offset the acute effects of caffeine. So in habitual coffee consumers who develop tolerance to caffeine, coffee may have some beneficial cardiovascular events.
And do the levels of these compounds vary depending on the type of coffee that you drink?
Yes, I think the levels depends on the coffee blend and also on the roast level.
So we all take our coffee differently, whether it be instant or espresso. Does the method of preparation influence the effect coffee would have on cardiovascular health?
It may influence. There are 2 main types of preparation of coffee: non-filtered method and filtered method. We know that in the filter method, some components in coffee, especially terpenes, are retained in the filter. And it doesn't happen in the non-filter method. Some studies suggest that those terpenes can increase total cholesterol levels in blood. We try to address this question, and we try to examine if we found differences between people who consume filtered coffee versus people who consume non-filtered coffee, and we didn't find differences in terms of total cholesterol levels and LDL cholesterol levels. But still, this is an open question, and we need more research on this.
So is there a heart-healthy limit for coffee consumption?
In our studies, consumptions up to 6 cups of coffee per day didn't show an increased risk of cardiovascular disease.
So I'm afraid we're nearly running out of time, and it's been so insightful to hear about your research on coffee and people with heart disease or those who are at greater risk of cardiovascular disease. Now, as a healthcare professional, what's really interesting to me is what practical advice you would give to healthcare professionals so that they can relay this to their patients.
Well, I will say that in healthy people, Moderate coffee consumption doesn't increase their cardiovascular risk.
And what do you mean by moderate?
Well, I guess it depends on the cup size. In the US, cup sizes are larger than in Europe. So I will call moderate consumption in the US to 2 to 3 cups of coffee a day, but I will call moderate consumption in Europe to 3 to 4 cups of coffee a day.
So what about those people who already have cardiovascular disease?
Well, our research suggests that moderate consumption among those who already have a cardiovascular event or are diabetic doesn't increase the risk of having a second cardiovascular event.
Thank you so much for joining us. That was really insightful. And if that's left you thirsty for more, then go on to coffeeandhealth.org for more research and podcasts on coffee and health. And if you like to tweet, then follow @coffeeandhealth for news on coffee, caffeine and health. Thanks so much for joining us.